Today, we're going to be talking about a very important subject, and that is breastfeeding. Something which is not only important for the child, but also the mother. In fact, 1st to 7th August is celebrated as World Breastfeeding Week. And because of COVID, it becomes even more important to talk about this subject and understand how good it is for the child's nutrition. Joining us today is Dr. Sharika Yunus, the head of Nutrition and School Feeding Unit, World Food Program India. Thank you so much, Dr. Yunus, for joining us today.
My pleasure. Thank you so much for having me.
So, Dr. Yunus, the first thing which I want to ask you, we're going to be having, I'm hoping that a lot of questions are going to be asked today on this platform. Why is breastfeeding important, not just for the child, but also for the mother? And as a nation, where do we stand today when we talk about breastfeeding? How are the numbers?
Sure. Thanks a lot for that question. And let me just start by saying that breastfeeding is something which is not only important for the baby, but it's also equally important for the mother. Like you said, for the baby, it provides protection against infection, it provides protection against mortality, and it also provides protection against the development of non-communicable diseases, overweight and obesity in later life. It also protects against a lot of diseases which may be associated with atopic conditions because it's rich in immunoglobulins. So diseases such as asthma, etc., it protects against them. As far as the mother is concerned, if the mother breastfeeds, then it protects the mother against postpartum hemorrhage, which is a complication in quite a few women post-pregnancy and post-delivery. It also protects the mother against ovarian and cervical cancers, as well as breast cancers. And in going forward, because the mother is breastfeeding the baby, it also protects the mother against another pregnancy, which may be unwanted at that point in time. And it also strengthens the bond between the mother and the baby. So a lot of, pros in terms of breastfeeding.
Yeah, absolutely. I mean, but in India as a nation, where do we really stand? Because the numbers aren't really good. And looking at COVID, unfortunately, a lot of children, infants have lost their moms, so which makes it even tougher. Nutrition is even more important now. As a country, do we fare good when it comes to breastfeeding? Are we breastfeeding our kids enough?
Sure. Let me first perhaps start by explaining what exactly do we mean by breastfeeding. It's a broad term, right? So there are three components to breastfeeding. The first component is that a mother should start breastfeeding within the first hour of delivery. Then a mother should continue to breastfeed the baby till the baby is 6 months of age. And once the child is 6 months of age and you've added additional foods to the diets of the child, which is called as complementary feeding, then you should continue to feed the baby for 2 years, breastfeed the baby for 2 years or beyond. So those are the three, let's say, components when we say breastfeeding. In India, we routinely capture data every 4 to 5 years through the National Family Health Survey, wherein there are a lot of nutritional indicators which are captured as well. So if we look at the previous NFHS 4, which was conducted in 2015-16, only about 4 out of 10 of our children were breastfed within the first hour of birth. If we look at how many children were exclusively breastfed, just slightly more than 5 out of 10 children were exclusively breastfed for 6 months. Now, when we compare that with the new data which has come in, the NFHS 5, which has only come in for about 22 states and union territories, what we realize is that 88% of women in India have delivered in hospitals. Within that, 51% were able to begin breastfeeding within the first hour of birth. 61.9% breastfed exclusively during the first 6 months. Now, if I compare the NFHS 5 data for these 22 states and union territories with the NFHS 4 data for these 22 states and union territories, we actually have come down as far as figures of early initiation of breastfeeding are concerned. So perhaps to say that we're not really doing that well, and there's more that needs to be done to make breastfeeding rates go up in our country.
So जैसे आपने बताया हम इतना अच्छा फेयर नहीं कर रहे हैं when it comes to breastfeeding. Dr. Ines, before we start taking the questions, हमें काफी सवाल आ गए हैं. मैं आपसे एक सवाल पूछना चाह रही हूँ कि वर्ल्ड ब्रेस्ट फीडिंग वीक आ रही है, इस साल का थीम क्या है?
इस साल का वर्ल्ड ब्रेस्ट फीडिंग वीक का थीम है प्रोटेक्ट ब्रेस्ट फीडिंग अ शेयर्ड रिस्पॉन्सिबिलिटी. इसका मतलब ये हुआ कि हमें अब ब्रेस्ट फीडिंग जो है एक पब्लिक हेल्थ इशू है. हमें इन्वेस्टमेंट ब्रेस्ट फीडिंग में चाहिए, हर लेवल पे हमें इन्वेस्टमेंट चाहिए. और ब्रेस्ट फीडिंग सिर्फ माँ की जिम्मेदारी नहीं है. ब्रेस्ट फीडिंग जो है फादर्स की भी रिस्पॉन्सिबिलिटी है. ब्रेस्ट फीडिंग लार्जर फैमिली की भी रिस्पॉन्सिबिलिटी है. ब्रेस्ट फीडिंग कम्युनिटी में वो मदर है, वहाँ की भी रिस्पॉन्सिबिलिटी है. और हमारे पॉलिसी मेकर्स की भी रिस्पॉन्सिबिलिटी है. सो ब्रेस्ट फीडिंग के लिए हमें इन्वेस्टमेंट चाहिए, हर लेवल पे इन्वेस्टमेंट चाहिए, चाहे वो हेल्थ सिस्टम, चाहे वो हमारे वर्क प्लेसेस हों, चाहे वो हमारी कम्युनिटीज हों. सो दैट द थीम this year, and that's what we mean by the theme and what we hope to achieve this year.
In fact, you know what you said, it's so important that we support. A mother needs a lot of support. That is something very, very important what you've said, whether it's the husband, whether it's the family. You know, I think that's a very important aspect. So let's take our first question, Dr. Eunice. Tapsi Malhotra is asking, what is the status of breastfeeding practice in India and how can it be further improved?
Sure. तो जैसे मैंने पहले बताया कि ब्रेस्ट फीडिंग के मतलब ब्रेस्ट फीडिंग तो एक बहुत ही ब्रॉड टर्म हो गया. ब्रेस्ट फीडिंग के अंदर जो है 2-3 कंपोनेंट्स आते हैं. एक है अर्ली इनिशिएशन, बच्चे के पैदा होने के 1 घंटे के अंदर ही आपको ब्रेस्ट फीडिंग शुरू कर देना चाहिए. दूसरा है एक्सक्लूसिव ब्रेस्ट फीडिंग, जब तक बच्चा 6 महीने का नहीं हो जाता उसको सिर्फ माँ का दूध ही देना है. खाने के लिए, पीने के लिए इसके अलावा और कुछ नहीं देना, पानी तक नहीं देना. हाँ, अगर जरूरत है बच्चे को ORS की या कोई दवाई देने की तो वो दे सकते हैं. ये मतलब हुआ एक्सक्लूसिव ब्रेस्ट फीडिंग से. और तीसरा ये है कि बच्चा जब ऊपर का खाना खाने लगे तो तब भी आपको ब्रेस्ट फीडिंग कंटिन्यू करना चाहिए जब तक कि बच्चा 2 साल का नहीं हो जाता. तो ये 3 पीसेस हैं ब्रेस्ट फीडिंग के. इसमें अगर हम देखें तो इंडिया में जो है हम पीरियोडिकली नेशनल फैमिली हेल्थ सर्वेस करते हैं, जो अब जो है हर 4-5 साल पे हमारे देश में होते हैं. तो जो NFHS 4 हुआ था 2015-2016 में, उस NFHS 4 में अगर हम देखें तो हमारे देश में 10 में से सिर्फ 4 बच्चे जो हैं पैदा होने के 1 घंटे बाद उन्हें माँ का दूध पी पाए वो. जहाँ तक हम ये देखें कि कितने बच्चे एक्सक्लूसिवली ब्रेस्ट फेड हुए 6 महीने तक, तो वो 10 में से 5 से थोड़े से ज्यादा बच्चे हैं. अब हमारे पास नया डेटा आया है NFHS 5 का. सिर्फ अभी 22 स्टेट और यूनियन टेरिटरीज का वो डेटा है हमारे पास. तो उस डेटा को अगर हम देखें तो अब 88% महिलाएं जो हैं अब हॉस्पिटल्स में डिलीवर कर रही हैं. उसमें से सिर्फ 51% महिलाएं जो हैं वो 1 घंटे के अंदर ब्रेस्ट फीडिंग शुरू कर पाती हैं. और 61.9% महिलाएं जो हैं, बच्चे जो हैं एक्सक्लूसिवली ब्रेस्ट फेड होते हैं 6 महीने तक. अगर ये जो डेटा 22 स्टेट्स यूनियन टेरिटरीज का है, अगर हम उसको कंपेयर करें NFHS 4 डेटा से, इन्हीं 22 स्टेट्स और यूनियन टेरिटरीज का, तो एक दुखद बात ये है कि एक्चुअली जो फर्स्ट स्टार्टिंग ब्रेस्ट फीडिंग विद इन द फर्स्ट आवर, बच्चे के पैदा होने के 1 घंटे के अंदर जो हमें ब्रेस्ट फीडिंग शुरू करना चाहिए, वो एक्चुअली रेट्स हमारे कम हो गए हैं NFHS 4 के कंपैरिजन में. तो हम ये ज्यादातर समझते हैं कि भाई ब्रेस्ट फीडिंग हो रही, इंडिया में ब्रेस्ट फीडिंग जो है कोई प्रॉब्लम नहीं होगी, ये तो हमारे कल्चर का पार्ट है. मगर ऐसा नहीं है. ब्रेस्ट फीडिंग में अभी हम और इम्प्रूवमेंट लाने की जरूरत है.
So Dr. Eunice, Vandana is asking us, is there any guideline for breastfeeding of lactating mothers after the COVID vaccination? I think because of the pandemic, you know, there's a lot of confusion whether pregnant women can take, lactating women can take. So any guidelines?
Absolutely. So a woman who has been vaccinated and is lactating and feeding a baby, she can continue to feed her baby post-vaccination as well. So those are the latest guidelines which have come in. There is absolutely no reason why a lactating mother should stop breastfeeding her child once she's been vaccinated.
So, we've got a question from Dr. Ritesh Singh. He's asking, does the vaccination in pregnant women prevent COVID in the newborn? So, मतलब अगर माँ ने इंजेक्शन लगाया है, तो क्या मतलब न्यूबॉर्न जो उनका होने वाला बच्चा है, कोविड से कहीं ना कहीं उसको प्रोटेक्शन मिलेगी कि नहीं?
It's a very good question, and I would just say that to the best of my knowledge, अभी ये बहुत established नहीं हुआ है कि अगर माँ को इंजेक्शन लग गया तो उसका जो अनबॉर्न बेबी है वो नेचुरली प्रोटेक्टेड हो जाएगा वैक्सीनेशन के लिए. अभी ऑनगोइंग रिसर्च है, and hopefully we should know the answer to that in some more time.
Dr. Yunus, Tarani Suneja पूछ रहे हैं that it's been seen कि rural areas में women शायद भी नहीं करते, जब breast feeding कराना पड़ता है और वो जितना लंबे समय कर सकते हैं वो अपने बच्चों को breast feed करते हैं, but often they lack access to good nutrition and diet. So और COVID ने इसको और भी मतलब बढ़ा दिया है, तो हम इस situation को कैसे address कर सकते हैं? Because obviously the mother has to be healthy to breastfeed her child.
बिल्कुल, माँ का पोषण मतलब अच्छी तरह से पोषित होना बहुत जरूरी है ताकि वो अपने बच्चे को ब्रेस्ट फीड कर सके. और कोविड के चलते हमारे एक तो पैंडेमिक है, और पैंडेमिक के चलते क्योंकि उससे रिलेटेड बहुत सारे एक्शंस हुए हैं जैसे कि लॉकडाउन वगैरह, तो जो हेल्थ और न्यूट्रिशन सर्विसेज की अवेलेबिलिटी है वो भी इम्पैक्ट हुई. तो डिफिकल्टीज तो रही हैं, बट जो हमें ये पता चला है कि गवर्नमेंट ने जो है आंगनवाड़ियों को सुचारू रूप से कोशिश करी है कि वो चलते रहे. वहां से जो खाना मिलता है लैक्टेटिंग वुमेन को वो ज्यादा इम्पैक्ट नहीं हो. तो वो सारी सिचुएशन और वो सारी फैसिलिटीज रूरल वुमेन को प्रोवाइड करने की कोशिश करी गई है सरकार की तरफ से. सो देयर आर फैसिलिटीज व्हिच हैव बीन प्रोवाइडेड. बाकी रहा बात कि माँ जो है even at the cost of her own nutritional status, she can continue to breastfeed. Of course, क्योंकि वो breastfeed करती रहेगी, उसका शरीर और कमजोर होता जाएगा, मगर वो breastfeed कर सकती है. ये बात अपनी जगह सही है कि उसका पोषण भी उतना ही जरूरी है, और उसके पोषण के लिए उसके आसपास जो आंगनवाड़ी केंद्र है वहां से खाना उसके लिए अवेलेबल होना चाहिए. और सरकार की तरफ से ये फैसिलिटी अरेंज करी जा रही है कि जो टेक होम राशंस उनको मिलना चाहिए थे आंगनबाड़ी केंद्र वगैरह से वो उनको मिले. दूसरी चीज जो यहाँ पे जरूरी है वो ये भी है कि शायद महिलाएं ये नहीं समझती कि उनको खुद को अपना पोषित रहना ब्रेस्ट फीडिंग के लिए कितना जरूरी है. तो इसके लिए कम्युनिकेशन कैंपेन होना चाहिए ताकि उनको ये समझ में आए कि एक तो ब्रेस्ट फीडिंग वैल्यू क्या है, और दूसरा ब्रेस्ट फीडिंग के वैल्यू के साथ साथ उनको अपने लिए क्या खाना चाहिए, क्या चीजें खा सकती हैं जिससे उनका पोषण स्तर और बढ़ जाए.
Something I want to ask you before we go on to the next question. What factors are responsible for suboptimal breastfeeding practices in India?
So if we talk about the factors for suboptimal breastfeeding practices in India, we could largely sort of club them in like 4 buckets. One bucket could be around the social, cultural, and religious issues. There could be one bucket around commercial factors. There could be one bucket around lack of awareness, and of course, fourth could be around health systems, and there could be more reasons to it. So agar hum if we talk about social, cultural, and religious issues, we do know that in different parts of our country, so the mother's first milk, which is called the colostrum, the most nutritious sort of milk which comes out, but it's slightly yellowish in color. So in different parts of our country, that's looked upon as dirty milk and often discarded.
Yes, yeah.
I mean, there are certain practices that we have within our cultures and social systems which do not lead to the practice of appropriate breastfeeding. The second is on the commercial factors. So there's an aggressive promotion of infant formula, milk powder, and other breast milk. Then our health systems, most of the times, they're overburdened. Also, in the training of our medical and healthcare workers, perhaps there isn't due emphasis on infant and young child nutrition, and therefore the messages that they should be giving to pregnant lactating women are not necessarily coming forth. And of course, the last is the lack of knowledge on amongst the community members, amongst women, amongst the caregivers of young children, amongst their larger families, as well as the policymakers, of not exclusively, the dangers of not exclusively breastfeeding or not knowing the proper breastfeeding techniques.
I think you've summed it up really well. This is something, I mean, when you were, like you said, like in some parts of the country, not, I mean, just because of certain beliefs or myths that, the child cannot get the, the milk, which is extremely important, the yellow milk, what you said, which is actually very, very beneficial for the child, and miscommunication, little more information to parents. And like you also said, Dr. Guinness, where we are at sometimes when we do not have enough medical staff or nurses, or even in the Anganwadi, Asha workers, to actually teach the mother how to breastfeed the child, in the right way. That's also, I think, a very, very critical step. We have a next question from Prerna Jha. She's asking, working mothers are often unable to breastfeed their child for up to 2 years after birth. There is guilt and also fear if the child is getting enough nutrition. How can this be addressed? Because with breastfeeding, there's something I think we've all seen is that you don't know how much your child is having. So you don't know how much nutrition is going in, plus you don't even know. Whereas when it's a bottle, you can actually see how much milk the child is having. So I think that fear is always there. Ki, have I fed my child enough? Kafi doodh mil gaya, peet bhar gaya hai. So this is something which Prerna wants to know.
Sure. So breastfeeding. So till six months of age, you need to exclusively breastfeed the child, right? After 6 months of age, you need to gradually transition the child to complementary foods, and by 1 year of age, the child should be accepting whatever the family eats. So in the period 6 months till 2 years, the child will start getting the additional calories, not only from the mother's milk, but also from the food that's being fed. Now, if we look at the first 6 months, so if the child is satisfied, if the child naturally comes off the breast, the child is no longer agitated, the child has sort of slept off well, the child is no longer crying. So those are all signs that the child has been fed well, no longer hungry, right? Now, after 6 months of age, the period between 6 to 8 months of age, still the child is dependent on the mother's breast, and there's a caloric gap of about 200 kilocalories as per the World Health Organization that needs to be met by complementary foods. So now gradually the child is being shifted to complementary foods. When the child is about 9 to 11 months, then the amount of complementary foods or the caloric gap that needs to be fulfilled by complementary foods is in the range of 300 kilocalories. And then when the child is between 12 to 23 months, it's in the range of 550 kilocalories. So gradually, it's not as if when post 6 months, the dependency of the child on breast milk reduces and on other foods grows. So if you're a working mother and if you're breastfeeding the child after 6 months of age, then your dependency on breast milk, the dependency of the child on breast milk is reduced, right? So whenever you're back home or before going to work, you can breastfeed your child. I think now also in India, as per the Maternity Leave Act 2017, there is a provision of 6 months, 26 weeks of paid maternity leave, which then helps the working women to a huge extent. Of course, it only helps working women in establishments which have more than 10 women and doesn't perhaps do much for women working in the unorganized. It's still a definite step forward for working women.
Great. I think, that you've really put it really well. Just something I want to know, like we've spoken about, हम बात कर रहे थे कि अभी इंडिया में breastfeeding जितना अच्छा होना चाहिए इतना है नहीं. The numbers are not that good. And especially when we're looking at the context of the COVID-19 pandemic, it's even made it more challenging, let me put it that way. Doctor, can you tell us how can we improve the situation when it comes to breastfeeding? You've explained us that why is breastfeeding important? It's extremely critical for the mother and the child. How can we improve the situation of breastfeeding in our country?
So in terms of improvement, there's a variety of action that needs to be taken, a whole plethora of actions that need to be taken. But let me try and sort of put forth a couple of actions that we need to do. We need to provide our hospital and health facilities the capacity to support exclusive breastfeeding. There used to be an initiative called the Baby Friendly Hospital Initiative. That initiative needs to be strengthened, revitalized, and institutionalized to provide, to support breastfeeding. Then in the education, in the curriculum of the healthcare workers and across cadres of healthcare workers, perhaps the in-service training or the pre-service education needs to lay adequate emphasis and stress on breastfeeding and infant and young child nutrition. Also, there need to be large communication campaigns talking to women in the community on the importance of breastfeeding. There needs to be better monitoring and more stringent implementation of the Infant Milk Substitutes Act because of the pressure marketing that happens for such products. Perhaps there, in other countries which have done well in pushing the breastfeeding rates up, also relied heavily on nutrition champions and celebrities who can talk about the importance of breastfeeding. So many steps that need to be taken. And most importantly, breastfeeding as a concept needs to be pushed forth into the community. So there needs to be a communitization of the concept of breastfeeding. And the importance of empowering women to exclusively breastfeed and having policies that encourage them to breastfeed both in the workplace as well as in public.
Okay, just another question which I'm a little inquisitive to ask you since you're the expert here. We know breastfeeding is important. Can you, in brief, just for our viewers, explain in simple words the link between diseases and nutrition? When a child who's actually breastfed will be healthier. So can you just explain the link between disease and nutrition?
The link between disease and nutrition, I mean, basically, if a child is malnourished, then the child is more prone to illness because being just by virtue of being malnourished, the immunity of the child is being compromised. So if the immunity is being compromised, meaning the child is more susceptible to infection. So therefore, there's this direct link between malnutrition, between the nutritional status of a child, as well as disease.
Okay, so just a last question before we wrap. This interaction, I think you've answered most of our questions which have come. Leading up to this World Breastfeeding Week, a message you would like to give people who are watching this Facebook Live?
I'd just like to reiterate the theme of the World Breastfeeding Week, which is breastfeeding is everybody's responsibility, and all of us need to come together to promote, protect, and support breastfeeding. So it's a shared responsibility, and each one of us needs to do our bit.
Thank you so much, Dr. Yunus, for speaking with us and sharing this very, very critical information. Thank you so much.
It's a pleasure.